Welcome back at 7:14. September is Childhood Cancer Awareness Month. This year, LSU Health New Orleans is putting the focus on transitioning from the treatment phase to the survivor phase. With us this morning is Professor of Pediatrics at LSU Health New Orleans School of Medicine, Dr. Pinky Prasad. Good morning, Dr. Prasad. Thank you for being with us so much.
Thank you so much for having us.
So let's discuss this whole idea of transitioning from treatment to survivorship. Why is that something that LSU Health is really wanting to focus on and highlight this Childhood Cancer Awareness Month?
So I don't know if you're aware, but 80 to 90% of our childhood cancers are now survivors,
Wow.
our patients, and so which is amazing. So survivorship really is a period of time between diagnosis and after cancer treatment is done. And we know this transition can be really difficult for children. It can be really difficult for parents. When you're in the cancer treatment phase, you're really focusing on day to day, and now it's like a whole different transition. And some parents and some children feel, wow, we're now not seeing our doctors every single day, we're not seeing them every single week, and they feel a little bit lost.
So what resources do you all offer, or are you now offering, now that the survivorship is so high, or the survivor rate, I should say, is so high? What resources are available out there that can help people navigate life after?
So we at LSU Health New Orleans, in conjunction with LCMC and Manning Family Children's, we have a survivorship clinic that's dedicated to pediatric and adult and adolescent cancer survivors.
Really?
Yes. And so this whole clinic is dedicated to making sure that our children that are now growing up to be adults and the parents are aware of all the different cancer treatments they received and what kind of side effects they're at risk for. So the goal is to kind of continue to educate them, and then that as they move into the community, these survivors will become advocates and be able to talk about their cancer treatment and then help other physicians and other people learn about how they should be taken care of.
Is there a mental health treatment aspect to your survivorship clinic? Because I would imagine being a child going through childhood cancer is earth-shattering, and then surviving it and kind of having a new norm, as you mentioned, of being in doctor's offices constantly and then not. What do you do with that life? And then, of course, for the caregivers, they're used to being right there alongside their kids or the children in their world. So what mental health resources are available in the clinic?
So we're very lucky that we have a clinical psychologist who's actually embedded in our clinic, who sees all of our families when they come through clinic. And she helps us figure out whether they need therapy, what kind of resources they need, and we make sure that they're hooked into those resources.
Where can people at home find out more information about this? Because again, and this is specifically for childhood cancer, but I would assume that because the survival rate is increasing across the board for several other types of cancers, this is becoming more common. But for these families of children who survive cancer, where can they find more information and get enrolled in that clinic if they haven't been already?
Absolutely. So there's a couple different places. One is just looking at the med school website, the LSU Health Medical School website. We also have a website on Manning Family Children's and LCMC Health as well.
Well, Dr. Prasad, thank you so much for your time this morning. An interesting way of having a discussion during Childhood Cancer Awareness Month, talking about surviving. And you can't help but love that, honestly.
No, you cannot help but love that.
We appreciate your time
Thanks
this morning.
so much.
All right, let's get over to meteorologist Zach Rodello with a check.